Hey guys, we're gonna be out in like a minute.
That always looks good. Yeah. Yeah, I mean, it definitely makes you ponder, doesn't it? It's like, wait. Excuse me, thank you.
Good morning, everyone. Thank you for being here today. I'm Congresswoman Linda Sanchez, a Vice Chair of the Democratic Caucus. Joe Crowley, who normally opens this, had a family commitment this morning. This morning, I'm fortunate to be joined by two outstanding colleagues of mine, Representative Kathy Castor and Representative Rodney Kelly. They'll be speaking after me. Last night, the CBO released its analysis of the Senate Republican health care bill, and the summary of that bill is pretty simple. Different bill, same results. Millions of hardworking women and men are going to lose their health insurance if this bill passes. The Republican plan is a failure for America's middle class because it fails to lower premiums, fails to improve care, and fails to expand access to more Americans. I think the worst part of this entire bill is the Republican lie that pre-existing conditions are covered under their plan. The truth is that it guts cost protections for people living with pre-existing conditions, and it allows insurance companies to jack up their rates. By making insurance so expensive, millions of Americans with pre-existing coverage or pre-existing conditions, will effectively lose their health care coverage because they're unable to afford it. Making something so expensive that it's unaffordable doesn't actually improve coverage. It's a terrible scam for America's working families. They're half-truths that they're peddling about their plan, and we need to be vigilant in reiterating exactly what is in this bill. Because families who think they are protected would find themselves facing massive out-of-pocket costs, and that's why we need to keep a close watch on this bill and the process. The bill keeps changing as Mitch McConnell is frantically cutting backroom deals to try to salvage this bill. He knows that he doesn't have the votes yet, and now it's up to every American to weigh in and make their voices heard. For the millions of people who are out there worried that they may lose their insurance, it's time to act. It's time for you to raise your voice and make sure your representatives know where you stand. If you're afraid of losing your health insurance, make sure that your member of Congress knows what's at stake for you and your family. Again, we are coming to the 11th hour. It's time to make your wishes and desires known. And now I'm pleased to turn over the podium to the Energy and Commerce Vice Ranking Member, Kathy Castor of Florida.
Well, good morning, everyone. I'm Kathy Castor. I represent the state of Florida here in the Congress. I'm pleased to join with the Democratic Caucus Vice Chair, Linda Sanchez, and my good friend and colleague, Robin Kelly from Illinois. I want to talk a little bit about what the GOP proposes for Medicaid. For the past 50 years, Medicaid has served as a fundamental promise to families all across America that if you have a child that's born with a complex medical condition, or you are disabled, or you have a family member that is diagnosed with Alzheimer's or is suffering the consequences of a stroke, there is a fundamental promise that you will not live your life in destitution or poverty. And that has been in place for 50 years. The GOP bill being considered for a vote this week in the United States Senate would break that promise, and for all the wrong reasons. The CBO reported yesterday that they propose under the Senate bill a cut of almost $800 billion out of Medicaid. That means out of our families, the care provided to our families for skilled nursing care in our children's hospitals, to make sure that our neighbors with disabilities have the care that they need. For all the wrong reasons, because the Republicans propose to transfer all of that care that currently goes to support our families across the country to tax cuts for wealthy special interest. Folks that haven't been clamoring, really, for those cuts. And they do it under the guise of this is their satisfaction of the political promise to repeal and replace Obamacare, the Affordable Care Act. Now, I remember the election season last year, and I understand that my Republican colleagues for many years have said we need to repeal and replace the Affordable Care Act. But never when they were out on the stump did they say that under the guise of the Affordable Care Act repeal, instead we're going to rip coverage away from families with relatives in skilled nursing, from Alzheimer's patients, folks with disabilities, children. Most children in the country receive their basic medical care through Medicaid. And if a child is born with a complex condition, or God forbid, your child is diagnosed with childhood cancer, it's Medicaid that makes sure that you do not live a life of poverty. So it is correct when they say this Senate bill is cruel, it's mean, it is not up to the values that we share in America. It's not consistent with the promise that has been in place for 50 years under Medicaid. So in addition to everything else that it does by ripping coverage away from at least 22 million Americans, stealing from the Medicare Trust Fund, raising costs, paying more for less, gutting the essential health benefits by saying states go forth and do whatever you please, it breaks that fundamental compact that we've had with families for 50 years. And as people begin to understand what this bill really does, the cruelty of it all, we've had folks lining up here outside the Capitol. The grassroots are on fire. They're sitting in senators' offices all across the country because so much is at stake this week. And I encourage families all across America, do not delay. If this matters to you, and it should matter to everyone in this country, no one is immune from a possible Alzheimer's diagnosis or a serious complex condition. Get involved now and contact your senators to make sure that this bill is defeated this week. And I'm proud to turn it over to my colleague, Robin Kelly.
Good morning, and thank you all for being here. Also, thank you to Vice Chairwoman Sanchez and Congresswoman Castor for your leadership in protecting the health care of millions of Americans. As the chair of the Congressional Black Caucus Health Brain Trust, I'm deeply concerned about the negative impact that Trump care will have on all families, especially African American families. As a mother, I'm heartbroken for the more than 100,000 Illinois children who will lose their insurance because Republicans are putting politics before people. Last week, after secret backroom meetings that I might add had no women, no Democrats, and no people of color, Senate Republicans have finally unveiled this bill. If you ask me, they should have kept it hidden. It is an embarrassment to them and an impending disaster for American families. Yesterday's CBO score showed us that premiums will go up, insurance will cover less, and 22 million will lose their health insurance, all to give just 400 super-rich families a whopping $37,000 tax cut. This entire bill is a complete and utter disaster that will impact American communities from Chicago to Baltimore, San Antonio to Anchorage. It will have a disproportionate impact on communities of color. Make no mistake, Trump care will turn back the clock on the progress we've made toward health equity. Under the Affordable Care Act, we cut the number of African Americans without insurance by more than half. We've also reduced the excess death risks from cancer that black men experience by more than half. According to the American Cancer Society, this progress is directly linked to the increase in healthcare access brought about by the ACA. Tragically, Republicans are working overtime to undo that progress. Instead of making advances in health care and health outcomes, they want to send us back to the days when families went bankrupt trying to pay medical bills. And I must add that I come from a district, I have the highest rate of foreclosures of all the districts in Illinois, and paying medical bills is a part of that. Even worse, back to the days where people didn't see a doctor because it was too expensive and died from a preventable and treatable disease. On Sunday, I was in Peoria for Sisters Rock, a health fair that helps low-income women and their families get care. The event is largely focused on raising awareness about breast cancer and mammograms. For me and the Black Caucus, ending breast cancer is a major priority because black women have a 40% higher chance of risk of dying from it than our white sisters. But regardless of your race, breast cancer is nearly 100% curable if it's caught in stages 0 or 1. Yet Republicans are taking away people's health insurance and funding to Planned Parenthood. This means that more women, and even more black women, will needlessly die from breast cancer. In Illinois, it means 60,000 going without these life-saving screenings. If you want to stand up to cancer, you must stand up and say no to Trump care. The American people know this. American people aren't buying what President Trump and Republicans are selling. A recent NBC Wall Street Journal poll found that just 16% of Americans think Trump care is a good idea. That's beyond a failing grade. The other 84% know that Trump care means that they will pay higher premiums for worse care if they can afford insurance at all. It's time to recycle the paper that both the House and the Senate Trump care bills are written on and come together as Congress, not Republicans and Democrats, but the elected representatives of the American people, and make health care affordable for all. Thank you.
Thank you, Robin, and thank you, Kathy. If there are questions now, it would be appropriate to ask. Yes.
You mentioned the poll, and the House bill did poll kind of dismally, and the Senate bill will probably poll similarly to that. But why can't you turn those types of unpopular ideas that the Republicans are pushing into wins for the Democrats? Why is there a disconnect between the policies that you like, because a lot of them do poll well, from gun reform to minimum wage to across the board, and yet Republicans keep winning these elections? How can you bridge that divide?
Well, the first thing is that legislatively, our priorities, we're not able to advance because we're not in the majority. Plain and simple. We have been saying for ever since the implementation of Obamacare that we would need to go back after several years of implementation and fine-tune it and improve on the areas where we could improve it. It's working for many Americans, and yet Republicans have this narrative that somehow it's failing. Many of the areas in which we could improve Obamacare, Republicans have been completely unwilling to work with us on that. And they've been sabotaging it, quite frankly. They've been undermining it by challenging certain provisions or not implementing certain provisions. And then they point to it and say that it's a failure when it in fact is not. If you come to the state of California, it's working very well in the state of California. And it could work well other places if there was a political will to do that. With respect to elections, elections have consequences, and the fact that we are in the minority in the House and Senate and that a Republican sits in the White House means that the consequences that really bad legislation like this that hurts a lot of people and could lead to the death of many people can actually get passed, because we have a majority that doesn't care that people will lose coverage, doesn't care about consumer protections, doesn't care that insurance companies will be able to raise rates on those with pre-existing conditions and those people will lose coverage. They really don't care, because this health care bill is not about health care for the American people. It's a tax cut bill. It is intended to deliver for the wealthiest Americans a huge tax cut. And they're dead set on doing that. They ran on a platform of repealing Obamacare, and when push came to shove and we said, what's your replacement? They cobbled together this terrible bill in the House, equally terrible bill in the Senate, that a majority of American people don't want. And those that stand to suffer and lose the most are those that are in those rural districts and those Republican held districts. We don't want to see people like that hurt, but we know that if this bill passes and becomes law, a lot of people are going to be hurting.
How would you characterize mood in the caucus now? I mean, we heard a lot of rumblings last week about the consequences of coming close to not winning these elections and what that meant for the future leadership. Has that died down? Is this a group of a select few who were making noise last November, or is this still gurgling?
If you were to take the sentiment of the majority of the caucus knew that these seats were very difficult seats to try to pick up, and yet you see the progress that we made over the last election cycle. We had double-digit gains in each of those seats. We came very close to winning some of those seats. I think that members are setting that aside. This week, we were singularly focused on the Senate health care bill. We are trying to get the word out to as many people as possible. This will impact you in a very negative way. Make your voice heard, not just on the Senate side, but on the House side too, because if the bill is passed in the Senate, it will come back to the House.
So that kind of insurrection has been quashed because people are focused on Obamacare this year, or it's still kind of out there?
I wouldn't even call it an insurrection. It's difference of opinion that members have. I mean, if you look at the Republican caucus, they have their internal battles as well. They've got the majority, and yet there's so much infighting and so much chaos within the Republican caucus. They can't govern. They can't even get, the basics of government functioning. They are more than 2 months late on a budget bill because they can't agree. So there's always going to be a difference of opinion within a caucus. But again, that's sort of a sideshow to what we're trying to combat this week, which is a really bad bill that's going to hurt a lot of Americans. Good questions. Yes?
If this does come back to the House, would you expect it to go to Caucus or just pass as is?
I've given up trying to predict what they will do. And again, my job is to sound the alarm and say this is a very real possibility that this could pass. You need to be talking to your members of the Senate and members of the House. Everybody in this country has a vested interest in what will happen, and everybody needs to be vocal.
Can I add to that?
Absolutely. Oh, I'm sorry, Rita.
I think for all of our neighbors back home, they need to understand the sense of urgency here, because there are powers at hand that really want to jam this bill through the Senate this week, and we all need to be on guard for the bill to come directly to the House, possibly for a vote on Friday or Saturday. Speaker Ryan has said this is one of his overriding desires. His reason to be in office is to provide massive tax cuts to the wealthy at the expense of hardworking families all across the country look at his past budgets. So my message to all of for working Americans out there is to pay attention. This could happen the Friday night before the 4th of July weekend. It could happen Saturday or Sunday. And even if the Senate delays it till after 4th of July, everyone needs to remain vigilant. There's too much at stake for families. They need to hold on to their pocketbooks because these Republicans are coming right after it.
And I'm fortunate enough to live in a state, and I have Senator Duckworth and Senator Durbin, so I know with the bill. But I'm urging my Illinois residents, if your family lives outside of Illinois and they have Republican senators, to please contact them, to contact their senators, that we all are in this together and we all have to fight together to make sure this bill doesn't pass.
Thank you.
Thank you.
Thank you all.